Okay, thanks everybody for waiting for us. Obviously, we're not a tech-based company. This keeps going in and out again.
I don't know what's going.
Is this going in and out again? No? I don't think this is working. Hello? Hello? Okay, we're just going to lean over here to see if we can make this work. So, for those of you who are wondering, we are Arconia. We are a non-thermal, low-level company based out of the United States. And our laser, the Emerald, is the only FDA-cleared device for a body circumference up to 40. This technology is amazing because it's non-invasive. Is this going in and out again? You all good? Can you hear me now?
Yes.
Okay, we'll try this again, all right? So once again, we are Arconia. We are a United States-based company. We have branches all throughout the EMEA as well, too. Our laser, specifically, is the Emerald laser. This is a non-invasive fat loss body contouring laser, which has no downtime, no side effects, and leaves no scarring and no pain. The laser works based off some specific cellular mechanisms, specifically affecting the mitochondria. Now, I know this might be a bit foreign to some of us in the aesthetics industry, but I'm going to let Jigna tell us a little bit more about the mitochondria, and specifically what goes on with the mitochondria and why this laser does what it does.
Right, you can hear me. Right, okay, so obviously, I'm just going to lean over like this and talk to you. So this is actually really important to understand because the differentiation with other types of devices that potentially destroy fat cells in terms of their technology, whereas this is trying to preserve a cell and discharge its contents. So why do we have mitochondria? So for a lot of us who might have done this back in med school days, we absolutely hate this chapter of our lives because we tend to forget about it, but actually you can't. So mitochondria are in the majority of our cells. They are best known for being the powerhouse of our cells. We use a variety of protons, and on the membrane of a mitochondria we have to have a set of processes to generate a very famous molecule called ATP. That is our energy molecule that's used for a variety of processes, for everything that we need to function in our body and our organs. And you cannot live without that. You cannot live without mitochondria. So that's just one element of what mitochondria do, but it has a whole bunch of other cool things that it does. And just to give you an idea, because this could go on for hours, it's very cleverly made to be able to take in proteins, for instance, that haven't been folded up to do its correct job, take it within itself and to correctly fold it so that it can do the correct function. Okay. It also needs to take in carbohydrates, fatty acids, amino acids, build those up into proteins again. So you can, Krebs cycle, that horrible thing, is actually very, very important. So yes, there's many metabolic processes that go on within our mitochondria that are essential to our health. It also generates metabolites like ammonia. And you'll also have its own DNA. So mitochondrial DNA is within our mitochondria and it can produce its own proteins. So without these amazing little things, we can't function. And in certain parts of our body, we need more mitochondria because there's a bigger energy demand. So for places like your brain and your heart in particular, you need billions upon billions that are generated with each beat or with each second. So we're dependent on these little things. And if we upset them in some way, whether that's through an external insult or the aging process, which naturally happens, yes, of course, these things can get rusty. And then therefore, if they're rusty, they can't generate the molecules that they need to. They can't generate ATP or energy. And you see this progressive decline, I say progressive, but exponential decline after a certain age. And the reason why this technology is very clever is because it helps to stimulate some of these processes without disturbing the fat cell itself. So we don't want to be destroying fat cells necessarily. And I have a question for you, if you don't mind me now asking, since we're on the topic. There's people here who might be interested in the laser, and obviously it caught my eye because I come from a medical perspective. I'm with Hineo Technology and supplementation to help support the actions of this type of device. Why is it important to know the difference between a pathological fat cell and a healthy one? It's
a really good question. Is this thing, can you hear me? So there are so many reasons to know differences, not only between cellular function, but structural function, right? And so when you look at the body, every single one of us right now in this very moment have cancerous cells in our bodies, right? I think that's a common misnomer, is that everybody, you're either healthy and then one day you're not. That's not true. Your immune system just does a really good job of clearing out those cancerous cells. Every single day you have cellular turnover. Now, the turnover rate in skin cells is very different than in your internal gut mucosa, which is very different than your muscular cells and almost non-existent in most of your cardiac cells. So this is a really important mechanism for us too, and this is what's beautiful about photobiomodulation or light therapy, is the fact that what you're doing is you're actually affecting the mitochondria inside the cell. Once again, it's a non-invasive, no downtime, pain-free mechanism. And what's amazing about that too is your mitochondria really are ground zero for longevity and aging. Okay, so how many of you here today want to live longer? Okay, how many want to live longer without disease? Right? Okay, so when we're in the longevity space and we're talking about aging, we're talking about biohacking, whatever label you want to put it, every single company out there today is talking about the mitochondria for this exact same reason. Now, when I was in school, your mitochondria we were taught that your mitochondria only produce ATP. But now we know that that's not actually true. Your mitochondria control your immune system. Your mitochondria regulate inflammation. What we're calling it now is it's actually called inflammaging, because we know the more inflammation you actually have, the quicker you're going to age, right? So looking at changes in skin tone, changes in gut functionality, changing in energy levels, cognition, right? All of these things are due to some sort of metabolic cellular process. But guess what? The DNA that you have today hasn't changed much since the DNA you had when you were a child. The only thing that's changed in it is specific mechanisms like methylation, your telomere length, your utilization of different molecules inside the mitochondria. And so while this is really important, this is on the cutting edge of technology, because in the aesthetics industry, we've put so much energy and time and effort into getting to people to actually look good. But what people actually want is they want to look good and they want to feel good. And what's interesting with this technology is that we're hearing from a lot of the doctors saying, hey, listen, people are coming in for fat loss and body contouring. But one clinic is a great example of this. One of their techs had Crohn's disease, and she was using laser for body contouring. But if you're working on a cellular mechanism at a cellular level, and you're altering inflammation, you're altering the immune system, what she was finding is that she was seeing changes in her Crohn's symptoms. And they were almost non-existent after she was using it for a couple of months. Now, I'm not saying that that's exactly what's going to happen for your patients, but there's clearly other cellular mechanisms going on here that haven't been investigated and aren't widely well known yet. And so my question for Jigna really is, if the mitochondria are so important, and we're learning about them now, what are other ways for us to upregulate mitochondrial function? It's going out again, isn't it?
That's okay.
What are other ways for us to upregulate mitochondrial function, and how can we apply this to our practice right now?
So I think that's probably going to lead me into thinking outside of the box a bit, and we've been talking about this already. To keep our mitochondria, to help our mitochondria, simple things, really simple things: sleep, exercise. Sounds boring, sounds like my day-to-day in general practice sometimes. It is of relevance. Our body needs to be nourished in ways that aren't always so complicated. What we consume, it perhaps might also need other ingredients to help kickstart the process at one end of making energy. So from my background, supplementation to help support mitochondria. But to also kickstart, and I guess to encourage healthy function, you have to start thinking about disease processes. So if you come and join me on a chat at the Medical Summit afterwards, I talk about recognizing your pro-inflammatory patient. That is pretty much every single patient that walks through your clinic door. It doesn't matter what setting you're in, whether that's medically, functionally, psychologically, aesthetically. You can read patients. And if you learn to read patients, not just their skin, you can see that there's avenues to help them in different ways, aside from obviously fat loss, which is wonderful for patients who need it, who need to be able to improve their health because their obesity is causing comorbidities. but you can help their well-being. And like you just said, looking good is one thing. We need to do better than that. You know, we have to start thinking about what does someone feel like when they feel well. They sleep better. They exercise, whether it's simple movements or whether it's graded, you know, all sorts of things. They nourish themselves with the right food. Hello? Food. Take 3, hello? Hello? I've lost my train of thought now. So yeah, just some other factors which help to support our mitochondrial function, which are easy things to do. You know, you don't have to spend thousands of pounds to do these things. What it does take, and I think Erik will agree with me, is accountability. It's putting in the work, it's taking responsibility to help yourself and to help your patients. And if you embody that ethos and give off that vibe as a practitioner, your patients are more likely to believe you, and not just the amazing before and afters, for instance, here, and for what we do in our stand across at Mayo. I hope that answers your question.
Yeah, it does. Yeah.
Are there any specific questions that any of you have? Like, how many of you are actually looking at mitochondrial function in your patients? Okay. How many of your patients or customers or clients come in saying that they're fatigued or tired? How many of you are asking those questions if they're fatigued or tired? Okay. Yeah. Why are they exhausted?
Partially because of the diet, lack of exercise, stress, anxiety in their life. I think stress plays a huge part, and it's like it cascades with the diet and exercise. Because if they're feeling really bad, they're stressed, life's got them down, they're not going to want to do the rest of it. So it just goes around.
I promise you, in the next 5 to 10 years, this conversation about mitochondrial function will become commonplace, where your patients will come in demanding that you understand and know those mechanisms,
Yes.
because they will know it better than you will if you don't get caught up. And this is the research that's coming out from even the early 2000s with David Sinclair out of Harvard, looking at Walter Longo and all this research into fasting, intermittent fasting, caloric restriction. Everybody is talking about mitochondrial function for longevity, quality of life, human performance, cognitive enhancement, depression, PTSD, anxiety. Every single thing is looking at 2 things, inflammation and mitochondrial function. And it's not that simple. What I'm going to tell you is that there's a lot of great physiology and metabolic mechanisms that are available to us today that can actually help enhance that. And this is one of the reasons why Arconia is not just in the fat loss and body contouring space. They have non-invasive lasers for chronic pain. They're FDA approved for acne vulgaris. They have lasers that are approved for neck pain, shoulder pain, plantar fasciitis, post-operative surgery. You know, non-invasive laser is going to be really popular because what it's doing is it's upregulating your cellular mechanisms without having any of the downside. How many of your patients enjoy having scarring after liposuction, or after cool sculpts, or after other mechanisms that are out there that are trying to help them achieve what they're looking for? These are really important things for us to understand because it's about quality of life. People want to look good, but they also want to feel good as well. And I think Jigna is a really good example of this too, is that she's been there and she's done that. And now she's working with these patients on a very different level, on a cellular level, using different types of therapies and modalities. And so I think it would be really nice for you to just talk about what you're doing clinically, because I think it's really important.
Okay.
And some of the new stuff that you guys are coming out with.
Okay. Right. So just a bit of background. By default, actually, I want to say by double default, I used to be a pediatrician. Then I became a GP. I'm still in general practice. Doesn't like me, does it? Still in general practice some of the time, and now I'm an aesthetic clinician. But then I discovered the world of functional medicine, admittedly only a couple of years ago, and that is because we are so laser focused, narrow-minded in this industry, let's be frank. But then I realized I'm an absolute geek. So how do I use my own example. I think I said to Erik before that the brain is a powerful place. You have to want to change, you have to want to make yourself better. And that's really hard to do when you're potentially stressed, mentally challenged, unwell. It's a serious thing. But there comes a point where the penny does drop, whether that's physical illness, emergency surgery in my case. It makes you think about what's going on and how your body is telling you everything you need to know. It's telling you how you're feeling, it's giving you the signs and symptoms, whether it's pericentral obesity or whether it's acne or rosacea, atopic dermatitis, psoriasis, you name it. But when I think about patients, I think, the first place I start with is I assess their mental health. Because you have to discover with these patients what is their will to change. How are you going to impact their ability to be motivated to do a treatment, to do a set of treatments, to invest in you? Are they going to follow a supplementation plan that I might give alongside supporting perhaps laser therapy? Are they going to understand that, building up your NAD or supporting your levels because you're exponentially losing that after a certain age, or you're needing the extra antioxidant support because you have a chronic disease condition, or you're constantly inflammaging, you're in chronic stress? I have to be able to work that out. If I don't ask the right questions, I'm not going to get the answers. So I always I look at a whole patient. I can read their skin really well, but I'm also really good at reading them as a person, and that takes skill. And my advice to you is to actually come out of your comfort zone. Make the time to learn from other specialties who are here, nutritionists, functional practitioners, medics, geeks, whoever, because if you want to expand your practice and you want to incorporate wellness, which is what this talks about, you have to make the effort to learn. But you have to ask the right people as well, because a lot of people don't know what they're talking about. And you're right. I think in the next, I don't even say 5 years, I think in the next couple of years, we're going to be so cellular and patients are so savvy. And what's been really good with me is that when I came into the functional side, especially when joined with Paneo, I was training functional medics, some of the best in the world, and they are firing questions at me about stuff I didn't know, which forced me to learn, but actually it makes sense. So you've talked about, for example, methylation. That's a process I'm pretty sure everyone's blankly staring at me right now. If you want a 2-second overview, come and see me afterwards at my talk. But it's so important to understand, because that patient might come to you and go, well, I need methyl this, I need that, but you don't have that. Why don't you have that? And there you are, churning out supplements potentially, which might not be the right ones for them, or they might need a different form. But regardless of that, I think if you actually step back a little bit and look at the whole patient and look at their functional system, how are they presenting to you? They'll often tell you, I've had this genetic test done, nutrigenomics especially, right? And I've got MT7RR whatever mutation, and they're like, so what are you going to do about it? And I've had that as a practitioner in training, and that's like, I don't need to worry because we've got the right supplement, we're all right. But these are the types of things that you need to start learning about, because it's going to be here sooner than you realise. I hope that answers that one.
I think there's a common misconception with chronic disease that sometimes you just have mercy to the deck of cards you've been dealt. But only 5 to 10% of chronic disease is actually genetic based in nature. And we still don't actually fully know how long that actually goes, because there's so many SNPs, there's so many components to our genetic makeup that even if you can find a genetic mutation, we still can't say exactly what's going to happen with that. So what does that mean? Well, 90 to 95% of your life and the diseases and the conditions that we treat in the clinic are actually caused by diet, lifestyle, nutrition, lack of sleep, stress, emotional dysregulation, the community you surround yourself with. It's really important. Your health is a decision you make every single moment of every single part of your day. It's not just when you see your GP or your provider. And so this is a really important conversation to have, because your patients are savvy. Your patients will start demanding more from you. 30, 40, 50 years ago, before the internet was around, there was a massive, massive disconnect because doctors had more information than their patients did. And so doctors were seen as authorities to make decisions and to be the authorities to be able to dictate the care and the quality of life for their patients. But that's all changed with the advent of the internet. If anybody's been on ChatGPT, I promise you, your patients can find more information about their situation than what they might be able to find from you in a 10, 15-minute visit in your office. That changes the dynamics. It changes the power cycle as well, too. Now, that doesn't mean you need to know everything, but it means you at least need to be aware of the conversations that are occurring at home and in your patients' families, because they're going to be asking you those questions. Now, the best part about that is learning new information helps to change your brain and change your body and change your thoughts as well, too. I think in medicine, we're so stuck in some ways about thinking the same way over and over again. And the plea to insanity is doing the same thing over again, expecting a different result each time. We know that there are things we thought in the 90s that are no longer true today, right? And now we consider them malpractice in some way, shape, or form. What if you're committing malpractice today and you don't know it? It's a scary thought, right? But here's what we're trying to motivate you to do, is to start thinking critically. Your patients are not binary. They're not 101s walking into your office anymore. They're a complex system. And you have to look at them structurally and neurologically and emotionally and all of these things we've talked about, right? Just even having, finding ways for them to have a better quality of life could sometimes be just getting them new social connections and having them feel like they sense of belonging, right? There's so many aspects that go into mental health, and I think that's why we're struggling treating it. It's not a mechanism. It's not just serotonin. There are so many other neurochemicals and modulators in our brains and bodies that we haven't paid much attention to.
I'll just add to that actually how to get those hormones going. So vagal toning. I'm an avid vagal toner. Didn't even know what it was about 2 years ago. But using other methods, I think the more we start to broaden our horizon, the more likely the patients are going to spend with you, the more likely they're going to follow plans I put in. But don't be afraid to branch out and work with others. A one-man band doesn't work, and I think, here's a really interesting environment, because if we look around the arena, and I'm just going to be bold and say we're probably the only two people having this conversation right now, apart from the people at the back in the medical summit, because the reality is we're more than just skin, we're more than just injectables and threads and whatever else. I'm sure you're probably standing here because you want to improve your own health span and lifespan to a degree. I don't certainly want to live forever, but what years I have, I want to live better and healthier and feel good. Sleep is a huge issue. I'm just being bold. I think it's important that we talk about how we help ourselves. Having gadgets is a huge issue, but it's also the best thing ever, isn't it? Eating better, all of these things require you to work with other people so that you can get the best, as well as smart technologies. We both speak for smart technologies, but there's also a lot of nonsense out there as well, isn't it?
Yeah. I think for some just closing kind of moments for us, the reason I got involved in medicine is because I was a patient first. Is this still on? The reason I
Talk to the thing now.
The reason I got involved in medicine is that I was a patient first, and then a doctor second, and then an advocate third. And now we're teaching and we're educating, because what we realize is that there aren't many providers out there actually doing what needs to happen, which is to teach. Doctor comes from the Latin root docere, meaning to teach. Yet how many providers out there are actually teaching new innovative technologies and understanding of these mechanisms? Very few. It's okay to be selfish. It's okay to try these new technologies on yourself. We're all kind of living petri dishes trying to figure out how to improve our lives. And so it's okay for you to be selfish, to try new things for yourself in order for you to try with your patients. I will never do anything with my patients that I wouldn't do to myself. That's always been my rule. So if I want to try something new, I'm always going to try it on myself, because we all have things we want to improve on. And that's okay. But I think more importantly too is that the game is changing, especially as we move into the next 10, 15 years. We're going to be having some very different conversations than we've had in the past. And if you're thinking like we did in the 90s, you're still going to be practicing like you did in the 90s. You'll probably get the same results as we used to get in the 90s. And things are changing very quickly. But it's up to you. And it's up to you having those discussions, and more importantly, thinking like an integrative practitioner, integrating as many different principles and understandings of human physiology is really where the rubber is going to meet the road. And I promise you, you will have clients and people coming back to you for years, not just for weeks or months, because they trust you to have their best interests in mind. And that's what gets me excited about the future of medicine. Jigna, what are you excited about?
I'm going to keep it short and sweet, exactly what Erik said. And being able to have better control over what we put in to our bodies, but also having people being receptive to our level of thinking, which is getting there slowly, but also technologies like this and things that come from this as well. So I'm conscious of time. I know the DJ's got to kick off. I'm not a DJ as well. But just to say that if you want to speak to Erik, he's still here, but he has to shoot off. If you want to come and join me on the Longevity Summit, I'm heading there now. And you can catch up with the team here. They can give you all of our contact details. Come and see Hineo on C20, which is straight diagonal that way, if you want to know about cellular supplementation the way we do it. And thank you so much for your time.
Go for it.
That was a challenge infused, wasn't it?